The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanic, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Welcome, TMD Warriors. We are gathered today for the next episode of TMD Demystified. I am Tony Urbanic. Last episode, I had promised to cover one of several topics that I had lined up. It appears that I am never at an end for adding new topics because I find out more and more about the whole process of treating TMD as I go along, even at this stage, after 12 years of first identifying the problem, coming up with a solution, non-surgical solution, and then bringing it to approval by the FDA and having a patent. And even now, 12 years later, I find that there are parts of this that need to be addressed carefully. I had last episode 3 items I'm going to talk about, but I'm going to make a change in plans here. For those that follow me on a week-by-week basis, if you're looking forward to one of these 3, I apologize. We're not going to cover those today, but those 3 are titled. We'll get around to them sooner. And the first one is regarding perio disease versus TMD. What does perio disease and TMD have in common? Amazingly, a lot. The second topic that is not going to be covered today is we have been given a phony roadmap for treating TMD. And the third will be entitled Why Doctors and People in General Want to Make TMD Complicated. But today we're going to talk about something that came up literally this morning as I saw patients. Today is Tuesday, my usual day to do episodes, and but I had to see patients today because my associate, Dr. Urbina, was tied up doing something very important for the practice, and I elected to see his patients for them today. And what came up this morning, I want to discuss. The topic for today's episode is the critical nature of understanding and following the protocol. I make it a point when I do consultations to emphasize how important following the protocol is to the total success of the device. The device, the Urbanic device, the simplicity of it. Basically, the device is nothing more, nothing less than unloading the temporomandibular joint adequately to decrease the inflammation within the temporomandibular joint. Just like a set of crutches would unload a bad knee, decreasing the inflammation and making the pain go away as long as you are using the crutches. That's it. So a critical part of the whole process, which is highly, highly successful, is to follow the protocol. If you have a bad knee and you're on the crutches and the pain goes away, but you decide to now the pain's gone and you put the crutches in the closet and you don't use the crutches anymore, I can promise you sooner rather than later, the symptoms are going to return of the knee problem. This stuff is not rocket science that we're dealing with. And that's, like I said, one of the other episodes we're going to do is like, why does everybody want to make this complicated? Well, I have a lot to say about that and why they do want to make it complicated, which it is not. There are certain parts of medicine that are complicated. Inflammation, for sure, is a complicated issue. We do not know everything we need to know by far about inflammation, but let's not go there. Let's just stay on the topic here, on point. the critical nature of understanding and following the protocol. I've discussed protocol before. I've discussed the importance of it before. But because of what happened today, I'm just on the warpath to make sure that those who are interested and follow these episodes on this podcast get the real deal, get the information they need to fully understand and treat the patients, get the solution. Treating the patient is not just treat the patient. Treating the patient is to actually get success, get the problem handled, to be successful in treating the patient, not just treating a patient and seeing what happens. We know that our success rate is extremely high, depending on, actually, it depends, this is the point, it depends on how well the patient will follow the protocol. If they won't follow the protocol, you cannot expect the success rate. And we'll talk about that in detail. Even when they don't follow the protocol, you can get some improvement, some success, but nothing near that if you follow the protocol and understand the protocol itself and how it works. And there's some nuances. Sometimes the device has to be adjusted, and when to do that, and when to actually understand that the patient's just not following the protocol. Again, it's like I'm pretty emphatic today because I had a run of patients. It was a busy morning. I had to see a lot of checks, a bunch of deliveries for patients. Many of them went really well. I'm not, it's definitely not all negative experience this morning for me, because I had, 3 patients who were, symptoms after 20 or 30 years, now 90 to 100% of the symptoms were diminished or gone. And we collected, a success story or two. And those are really good things. But because of the other experience I had this morning, I have to emphasize and discuss how important it is for the doctor to understand the importance of the protocol, and more importantly, for the patients to understand the protocol, and what happens when you don't, and what happens when you do. And so for the benefit of the patient. Now, I'll try not to be disjointed. I do have some things in sequence that I want to discuss. But first of all, I did have at least, I had 3 major episodes this morning of patients who presented at different points in the timeline of treating one of these patients with unexpected, diminished results, or to say it the opposite, increased symptoms, or symptoms that had not gone down to the point that we expect. In all 3 of these patients, on questioning, the patients did not use the device appropriately as requested. That's called patient compliance. As a maxillofacial, oral and maxillofacial surgeon, doing major facial reconstruction, and of course all the office oral surgery that I did, but both office oral surgery, tons of wisdom teeth, like bazillion dental implants, and a lot of major reconstructive complicated facial cases. I had my share of patients who, for one reason, would not follow the protocol. I had my share of patients who unwired themselves after being wired together after trauma or orthodontic surgery. Fortunately, they were not many. And I say right up front here, most patients, 80 to 90% of let's put it this way, 80% of patients are excellent patients. 80% of patients. They do what you ask them to do. They may complain a little bit, but they do what you ask them to do for their benefit. They follow whatever necessary to do it. They appreciate being aware of what to expect and things like that. 20% of your patients cause problems of one variety or another, and a small number, roughly 1.5% to 2% of patients are just on a bent to create problems for you and for themselves. 18%, well, and that's the 18% that I'm speaking of today. 18% of patients generally have a hard time following directions. They do what they want to do. And some of them admit it, some of them won't admit it. You can't always get a truthful answer, but keep in mind, draw back to 80% of patients are honest, 80% want to work with you on 80%. So that's the vast majority of patients. So I'm only speaking of a small number, but it's a significant number, and this is the reason it's important. If you do not recognize the patients who fall into that 20% and you don't know who you're dealing with, you're going to, as the provider of this device and protocol and treatment, you're going to call it a failure. It's not a failure. It's a failure to follow the protocol. It's a failure of patient compliance. Actually, it's a failure of understanding. So let's go down this road a little bit. If you take the time, take your time, and you know how to do it, which I've spoken of just in multiple episodes on this podcast over the past 2 years. If you take your time and to, first of all, understand for yourself what you're doing, how the device works. It's simple. It's not rocket science. It's easy to understand. It's easy to explain to another. But if you take your time to do it for the patient's sake, they will more than likely be very compliant. They're more likely to be compliant when they understand what they're doing and why they're doing it. Let's go back to something that isn't so timely and charged right now, and that is, when I did a lot of trauma and in the emergency room all night, and next morning you discharge the patient and they're wired together, and a week later the patient comes back in and now they cut their wires. It's like, why did you do that? Well, they didn't understand that if you have a jaw fracture or a maxilla fracture and they're wired together for a reason, they don't understand that if they unwire themselves, it won't heal correctly and their bite will be all off. And so they just unwired it. Well, now then it's important to understand, it was my problem saying, don't unwire yourself, because if you do, you're going to create a big, big bite problem for yourself, which may never heal. So it's really the responsibility of the provider doctor to get these communications understood and across to the patient so that the patient is more likely to be compliant. You have to have a compliant patient to do the protocol. What's the protocol? The protocol is very simple. It's been worked out over a long period of time with literally thousands of patients. It is not set in stone. You can change the protocol depending on circumstances, but in 90% of the patients plus, the protocol works. And if you follow the protocol, you don't have to worry about doing any exceptions. And the protocol for using the device properly is putting it in your mouth 24/7 for the first 2 months, except when you eat. And then most often, almost all the time, in the follow-up, at 2 months, you can put the patient into nighttime only, or when they sleep, sleeping time, nighttime, nap time. And 15% of the patients need to wear it more during the day. These are worked out by experience. 15% find they need to wear it more during the day because they have recurrent symptoms, but if they wear it an extra 6 or 8 hours a day, they can keep those symptoms under control. So 85% of the patients, once they go through 24/7, they go into nighttime handles them. And after a little follow-up, making sure that they're stable, then they can be discharged and then come back when they lose or break the device, or they have any other kind of problem, which I'm going to probably give you a couple examples about that. And 15% find they need to wear it more during the day. Again, this is by example, this is by experience. Heuristic, I think is the correct word. Learning by experience, heuristic. And they come in And of course, they're mostly female ladies. And I can't tell you the number of ladies who come in and they go, I figured out when I'm in traffic, I put this thing in my mouth. I figured out when I'm on the computer, I put this thing in. Well, why the computer? Why traffic? And that's when they clinch. I actually had a patient 2 days said, when I'm cleaning house, she says, I know when I'm cleaning house, I'm doing this. All right. Whenever, but it's up to the patient to determine if they need to wear it more, and it's 15% fine, they do. So that's the protocol. That's the expected experience with the protocol. And if you do the protocol, you'll get the result. And it's unfair, inappropriate to take a person and put them into the protocol and have them non-compliant and then say the device is ineffective. So getting the specifics, today I had 3 people. I don't have to get too dramatic about it, but each of them came in at different times during the protocol with unexpected consequences, with symptoms that they had got initial improvement and then they fell back. And on questioning, because when I see that happen, when you see, they get up to 50% of the symptoms are gone, 70% of the symptoms are diminished or gone, 80% of the, and then they go back lower, you have to ask what's going on. The most likely thing that's going on is that they have not followed the protocol. Again, and the biggest problem of that protocol, admittedly so, is to ask the patient and to expect the patient to wear the device 24/7 for the first 2 months, except when you eat. One of the patients today, on questioning, I said, did you wear the device as expected 24/7? And again, 80% say absolutely yes, 80% plus. But this particular patient said no. I said, bad, bad, bad. What did you do? She says, I didn't wear it during the day. I just wore it at night. And I said, you cannot expect this device to be effective as it's supposed to be if you do not wear it appropriately. And she shook her head and knew it and agreed. But, her initial result at that point in time, where I was expecting 50 to 70% of her symptoms diminished or gone, she was only at 20%. And so in this particular case, I wasn't, I don't berate patients at all. I've certainly, that doesn't help and will not do that. But this is what I said. I said, I'll just make up a name. I said, Linda. I said, Linda, how important it is if you want the result, you have to follow the protocol. What can I do? What could I do as a doctor to encourage you to make it clear and to get you to actually wear the device during the day? Also, I said, what could I do? Because we know you haven't. And she said, nothing. And I said, there's nothing I could do? She says, yeah. She says, I'm just stubborn. Now, how can there's no actual argument, but what can you do academically to argue with that? You're dealing with folks. If you are a dentist, every day you have a long line of patients who you sit next to that chair, and you're dealing with a different personality. And you all know that. And the hardest part of your job as a dentist is not doing the technical tooth work or surgery or periodontal treatment or root canals. The hard part of what you do every day is dealing with the patient that is connected to those teeth and bone and gums. So it is, but on the other hand, getting back on point here is the critical nature. If you want the results, you have to get the patient to understand and to do the protocol. That gives your best bet. And when you are certain that they actually are doing the protocol and you're still not getting the result that you expect, then that's a different category. And that is well known. That is the time where you have to consider to modify the device, increase the vertical dimension. And that is covered well on other episodes. We won't go there. I want to just stay on point. And that is The point is the importance of educating the patient as to the critical nature of the protocol, and not just saying, here's the protocol, you got to do it. The protocol as to why it is necessary, why this device is no better, no worse, just like a set of crutches for the knee. And if you get off the crutches too early, or you don't use the crutches correctly, then you can't expect the symptoms to diminish. I had one patient a while back, this isn't one of the 3 patients today, but I had one patient come in that had a device in for 10 years, early device. And we found her chart, and I looked up her information, and she had a whole bunch of symptoms. She really did very, very well, went through the whole protocol very quickly. And then I discharged her with these instructions, which I give to everyone. So I know I gave it to her. You have to wear the device every night, indefinitely, the rest of your life. Always keep it in the case, because that'll keep it safe. Always keep it clean with toothbrush, toothpaste. If you do those 2 things, the device will last indefinitely. So, your investment in the device was well worth it. It'll last a lifetime if you do those 2 things, and you keep it in every night, and it'll keep you safe, and it'll keep all the symptoms away. And this patient came in after 10 years, and it said reconsult. And I walked in the room, and I recognized her, and she said, my symptoms have come back. I said, wow. I said, that's, it can happen. I need to check your device, might need to be adjusted or whatever. I said, so how have you been using it? You've been using it every night? Oh, no, I quit using it. You cannot expect the device to be effective if you don't use it according to protocol. And again, there's a reason for this protocol. And you have to understand the reasoning behind it, what you're actually doing with it. And that is opposed, our protocol, because that's why it's called an Urbanic device and protocol. It goes along with the protocol, and it is unlike any other oral device that's out there, which that's what they all fall into category. The other things that are given or used, the bazillion night guards that the general dentist, prescribe and use for the patients, or I will leave the other TMJ devices unnamed, but they just give the patient a device and said, put it in your mouth. Just put it in your mouth. And some people use it at night, and some people don't use it, and some people use it for a week until the pain goes away, and there's no direction as to how and why to use it. So, and it's a disadvantage for the doctor, because if he does not realize that it is not being used correctly, then he'll come to different conclusions about how to use it or what to do with it, or that it's a failure, it doesn't work at all. And he doesn't know that the protocol was not being carefully and correctly followed. And if the protocol is followed, now emphasized for the second time, and you still having problems with the symptoms, then it leads to, okay, now we need to change what we're doing. We need to modify the device. We need to increase vertical dimension. We need to recommend wearing it a little more. One of the other patients that came in today was not wearing her device, and she was just wearing it nighttime. And the recommendation was, after looking at the device and listening to the history, was you just need to put this thing in more during the day. You can wear it as much as 8 hours per day extra. You cannot wear it 24/7 indefinitely. That will create, sooner or later, super eruption of posterior teeth. But 24/7 for the first 2 months will not, in an adult mouth, create super eruption. And again, I'll just mention, comes to mind, you can see the mandible drop back to centric relation and create what some people want to call super eruption, but it isn't super eruption. It's now the mandible's back in centric relation, and if there's a large difference between CO and CR, it will create what looks like, posterior teeth meeting first. Well, that's not what you're looking at. You're looking at a big COCR change, and now the mandible's gone back to rest position, which is centric relation. That's what we used to call it in my training early in dental schools. Centric relation was the rest position, which allows the inflammation to diminish. At which point, if there's a big enough change between CO and CR, it can create an open bite, or my teeth don't fit together evenly. It must have caused super eruption. Nope, didn't cause super eruption. This is change in COCR. All right, I made the point. And I got onto this because the reason I brought this up today, and I emphasize it so strongly, is because the doctors who are interested in becoming a network provider, or if you are a network provider, you will see these patients. You will have to address these issues with patient compliance. The protocol is extremely important. It is critical. And true, like one patient that I mentioned, she says, I'm stubborn, I'm just not going to do it. And as long as then they know that they can't expect as much results, good results, then it's okay. And even those patients who wear it like whenever they want, get results, they're just not anywhere near as good and predictable. And what we're after is good and predictable, like our independent university study showed. We have extremely good results from the point of view of the patient, and the point of view, if the patient follows the protocol, you can expect patients to tell you routinely 95% of the time that they have significant diminishment, not 85 to 95% of their symptoms are gone 95% of the time. And that basically is what our independent university study has proven based on 3,000 patients who were studied. All right, I won't go on. With that being said, I want to encourage anyone who has questions to question, anyone who wants to criticize to go ahead and criticize. I'm available to speak about any part of this topic at any time. I can be reached at tony@tmjservices.net. Our Director of Education and Marketing, Dr. Naomi Engelman, can be reached at naomi@tmjservices.net. Those who would like to look into joining our network of doctor providers throughout the United States, which is increasing in number now pretty rapidly, can find out more originally or easily on our website, which is www.urbanictmj.com, because we rebranded recently. And I look forward to our next discussion, episode, conversation. And I'm going to pick out one of these three topics and go on to what I promised talking about. You got to hear about the relationship of periodontal disease and TMD. It is really important. I look forward to doing it for you, with you. For today, I'm Tony Urbanic, and this is TMD Demystified. I look forward to the next time that we can get together.